Hi, my name is Mariette, student of nursing 2010. This is video number 1. We're scanning the room now. I am doing assessment for the head skin, nails, hair, eyes, and nose. And I have my friend here using her as my patient. Her name is Ramatu. She's 18 years and above. She's above 18 years. So I'm about to do an assessment for video number 1 for nursing 210. So the first thing I'm going to do is to inspect Ramatu's skin. I'm going to, on her upper extremities, so I'm going to inspect the skin to see whether there are any discolorations. It looks like her skin on her upper extremities are all even, intact. Her skin is intact and it's warm, and the colors are even. No signs of any lesions or vessels, nothing like that. And her skin is also warm. And now check the skin toggle on her arm, the back of her arm. I'll pull the skin. The skin toggle looks normal. There are no signs of dehydration here. So, and my next session is to check for her, for the lower extremities. I'm going to ask Ramatu to lie down so I can check and inspect her lower extremities. Thank you, Ramatu, for doing this with me. So in the lower extremities, we do the same. I inspect to see whether there are any lesions or any skin discolorations. Checking the nails also to see whether there's any clubbing. And the hair distribution on her lower extremities looks normal. The skin has no lesions and it's warm and intact. So my next section to inspect, I'm going to inspect Ramatu's nail bed to see whether there are no clubbings or any discolorations on the nails. The shape of the nails is diamond and not curving. I check for that. I check for any signs of infections under the nails. I see no signs of infections under the nails, and the nail bed is normal. So my next section is to check, do the inspection for the head and the scalp. What I will do here is ask Ramatu, tell Ramatu that I'm going to inspect her scalp on the head and her hair. I will be patting her hair to see whether there are any lesions or any discolorations. I see none of that here with Ramatu. And I'll also check her skin color on her face. I will check for symmetry. I don't see any, no signs of asymmetry. Her skin on her face looks normal, evenly distributed, and symmetric. I'm still inspecting the head to see whether there are any asymmetric on the head and checking for head movements. I'm going to now inspect the temporal artery on Ramatu's temple, and I'm going to ask Ramatu to open her mouth for me and ask if she's having any pain while we're doing this. Can you open your mouth, Ramatu? Any pain while I'm doing this?
No.
And I'm going to check the other side and also feel the skin and palpate the skin to see whether it's asymmetric and whether there is any swelling while I'm doing this. I'm going to ask Ramatu, can you open your mouth for me? and see if there are any pain.
No.
No. Okay. So I'm looking at Ramatu and then looking at her eyes and see whether there are any asymmetry of the eyes. I see that her eyes are even, and I'm going to put my finger in front of Ramatu to look at my finger while I inspect her eyes to see whether there's any asymmetry with her eyes, and also check her carotid artery here on the neck. I'm going to palpate as well as auscultate. First I will palpate each side, and I'm going to ask for Ramatu, can you lean your face to the side where my finger is? Is there any pain there? You feel any pain? And I feel the carotid artery. I can feel it. I will do the same on each side. I will ask Ramatu, can you bend your neck towards my finger? Okay. And yes, I feel the artery. I can palpate it and feel it. So next thing I'm going to do is listen, auscultate. I'm going to put my stethoscope right in the carotid artery and listen for any bruit. Ask Ramatu to swallow for me. Good. And I'll do the same on either side. Hang on. Can you swallow for me again? Good. You don't hear any bruit. Okay, still on the inspection of the face, I'm going to start on the eyebrow to inspect and see whether the eyebrow symmetric. Ramatu's eyebrows are symmetric and her eyelids is symmetric, and I'm just going to check the eyes for the reflex, red reflex. See, Ramatu, can you look straight ahead? Okay, check the one eye, see whether there's any red reflex, and check the other one. And I'll check also the movement of the eyes, the reaction to the light. I am now going to check on the sinus, Ramatu's sinus. So when I be sure that Ramatu's head is straight, I'll check on the, it's nice and soft. Do you have any pain?
No.
For your sinuses here? And now I would ask Ramatu to open her mouth, open and close, and clamp her teeth down. I want to see if she has any pain, and while she's doing that, can you open your mouth and close and then clamp your teeth down? Any pain with that?
No.
Okay. So now I'm going to check Ramatu's ears, checking for any swelling and redness to the ears. I'm going to ask that you, can you lean towards me just a little bit? I see a normal ear. I don't see any redness or swelling. I will check the other ear. Can you bend towards me a little bit? Okay. No redness or swelling noted. It looks like both ears are normal. And I'm going to now check and get rid of this. get a new one to check for Matthew's nostrils. Can you lift your head up for me 1 second? Okay. Now other side. I see symmetry and no swelling or redness, no signs of infection noted. Now I'm gonna check her Matthew's throat, neck and throat. So I'm gonna look for skin color. Any skin color, I'm gonna palpate carotid artery, making sure that her head is straight and at a normal angle. I palpate for any swelling or pain. Do you feel any pain while I'm pushing down here? No, Matthew?
No.
Okay. I don't see any, and I don't feel any swelling either. And my next step is to check for the let's see. I'm gonna check her Matthew's neck and her, what is the name of that again? So now I'm gonna check Matthew's mouth. I'm gonna check for her mouth, her gums, and her tongue. I'm going to ask her Matthew to please open her mouth so I can check. Say ah.
Ah.
Okay, so I'm checking for the gums to see whether the gums are receding or any swelling on the gums and color change. And I'm going to ask her Matthew to lift your tongue up for me, all the way up. See symmetry, and I don't see any sores, no lesions, and the no signs of any swellness, and the gums are not receding, and her teeth, checking for her teeth also. That away. Oops. Next segment is to check the lymph nodes. I'm going to palpate lymph nodes on either side. See whether there is any enlarged lymph nodes, any swelling, and are you feeling any pain as I'm palpating?
No.
Here, no pain. And also checking to see whether if you can lift your head up like that. The swelling, I've checked before, but we can also check to see whether the lymph nodes are symmetric. As I'm going to ask them to just swallow while I'm checking that. Okay. And I'm going to check the alignment of her trach, which is centered in the center of her neck, and I don't see any protruding loops on her neck. I'm also going to check the symmetry of her shoulders close to her neck, and mandibular plates seem even and symmetric. Also, I'm going to ask her Matthew to bend her face and touch her shoulder. Any pain with that? And we can do the other side. Any pain with that?
No.
Okay. All right. Thank you. In addition to the checking the eye vision, we're going to do the Snellen test. I'm going to ask for Matthew. I'm going to ask for Matthew to do 3 segments of this Snelling test. The first one, I'll ask you to put this, cover your eyes with this, cover one eye at a time, first the right or either way, and read that for me. There's letters are there. We're trying to check which ones you can read as far as you can. So first we do the one eye, and then the next you cover the other eye, and then the third one we don't cover any eyes, so we're checking 3 segments. So here I'm going to ask you to cover that one eye, and if you can read that for me. I'm not going to be in the vision there, but so can you read the first line for me?
FP.
Okay, second line.
COZ.
Okay. Next.
LPED.
Okay. Next.
PECFD.
All right. Next.
EDFCZP.
Say, repeat that one.
EDFCZP.
Okay, and the next.
FELOPZB.
Okay, thank you, Matthew. Can you do the next one? First line.
FP.
Okay, actually that's the second line, but the first is
E.
okay. Second line.
FP.
Okay. Third.
COZ.
Okay. Fourth.
PLPED.
All right. Next.
PECFD.
Okay. Next line.
EDFCZP.
Number 7.
FELOPZD.
Good. Thank you. So now we don't need to cover any eyes. So if you can read from number 1 for me, please.
E. FP. TOZ.
Okay.
LPED.
All right.
PECFD.
Okay.
EDFCZP.
Okay.
FELOPZD.
Okay. And the next one, please. Last one.
DEFPOTEZ.
Thank you. Thank you. So this concludes the Snelling test. I thank Ramatu for allowing me to do my assessment with her. And this concludes the assessment video testing for video 1. Thank you. Okay, this section I'll be doing a Webster test and the rating test. I'm using the turning fork, and first I'll do the Webster test. You feel any vibration?
Yes.
Okay, and is it going away slowly?
Yes.
Okay. And next I'll do the rating test. And I'm going to use the plug equipment again and do the rating test in the back of the ear. You feel any vibration?
Yeah.
Is it going away slowly?
Yeah.
I'll do on either side. Alright. You feel anything? Let me do it again. Feel any vibrations?
Yeah.
So now I'm going to do the whisper test. I'm going to whisper to Matthew's ear. And did you hear any whispering from Matthew?
Yeah.
Okay, did you hear me whisper?
Yeah, I do.
Okay, let me try the other one. Can you tell me what I whispered?
He said window.
Window. Okay. Thank you, Matthew. This concludes the video testing number 1 inspection of the head and scalp and hair, face and neck, eyes, nose, and mouth. I want to thank Matthew very much for being my patient through this assessment. Thank you.
You're welcome.